Hello, good evening. So today we will be talking about Trichomonas vaginalis. It's a sexually transmitted infection which is quite common in USA. There are other sexually transmitted infections too, but today we'll be looking about Trichomonas vaginalis. So Trichomoniasis is a bacterial infection which is caused by a one-celled animal, that is a protozoan. It's a bacteria in from the protozoan family. So it's caused by a bacteria called Trichomonas. That is the name of the organism, Trichomonas. So when it said it is sexually transmitted infection, it can be transmitted through sexual fluids, like through vagina, oral sex, and also anal sex. But the good thing about it is it is curable and it can be tested early. The earlier testing and early treatment is really helpful for this. So coming to the life cycle of Trichomonas vaginalis. So this organism, this protozoan, resides in the vagina, urethra, and prostate. Prostate in the man, vagina and urethra in the woman, where it replicates by binary fusion, that is, it multiplies. Trichomonas vaginalis is transmitted among humans and is only known host primarily by sexual intercourse. Like I said, it's a sexually transmitted infection, so it's the main way of transmitting is through the sexual intercourse, direct contact, and non-venereal transmissions. Indirect contact is very rare, but sometimes it does happens. And here I'm showing the life cycle, that is the infected stage. And infected stage is called the trophozoite. That is, the parasite will, in the infected stage, it will be called as trophozoite. So coming to the symptoms of Trichomonas vaginalis. So the main symptoms are like a patient might feel odor, that is a bad odor, or foul smelling in the vagina, and she can also see a gray or yellowish vaginal discharge. In the starting earlier stages, it will be like a thick or thin mucousy vaginal discharge, but later on it will be gray to yellowish or white yellowish color. Some patients can also complain of vaginal bleeding, genital burning. Some complain of genital swelling. And in some patients, you can also see a frequent urge to urinate. Some have dyspareunia, that is nothing but pain during intercourse. Coming to the males, they'll also have pain during urination, and also they'll have more urge to urinate. So that is about the symptoms of Trichomonas vaginalis. And coming to the testing, because there are more symptoms, you need to know how we can be tested and how we can be diagnosed, and then how we can be treated. See, the picture which is showing, it's the vagina, it's the urethra, the female vagina. So the swab will be inserted into the vagina until the cervix. The swab will be collected from there, and that is the mucus collection which we just told about, thickish yellowish to greenish discharge. We'll collect that swab and take it in a test tube in a sterile way, and then this can be tested through microscope, culture analysis, and and the other tests, there are like home-based tests, that is trichomoniasis tests. The trichomoniasis test, it's a new thing in the society, where every well as a brand which is producing the trichomoniasis test, which patient, if she or he are having, if she is having any question or any thinking about it, if she wants to check by herself in home, she can follow these steps. So how it works is, like, you take the Trichomonas vaginalis testing packet. After taking that, you can register using your unique ID. Each test will be provided with a unique ID. you need to collect your sample from home and mail your sample to the prepaid shipping label which is being left inside. While collecting sample, you need to be very careful that you put the swab straight inside, like into the vagina, like in little more deeper, just like you put in a tampon. You can collect it like that, but do not, when you collect it back, do not touch the swab in outer area of the sample, outer area of the test tube, or do not touch it onto the toilet. As soon as you take it, immediately insert it into the swab, into the test tube. And the instructions would be very clearly given, like you can break this swab, uncap it tightly, and you need to mail your sample using the prepaid shipping label. Coming to the treatments, because in the first slide and the first I told it is curable. The Trichomoniasis vaginalis is curable. When it comes to the treatment, there are different options. The main prescription or the first line treatment which is being referred by or advised by CDC is Flagyl prescription. And while taking Flagyl, we are not supposed to drink alcohol, because the Flagyl reacts with alcohol and you get more of withdrawal symptoms. There are also lotions and creams, are like some patients, if they have hypoallergenic, they will not be using lotions and creams, but there are other preparations available too, the gel kind of preparation available too. But mostly the main first line treatment is oral Flagyl, oral Flagyl and metronidazole. That's the main suggested first line treatment. And again, we should not douche. The douching is not good. And we need to avoid alcohol and make sure the sexual partner is also treated too, because you are, I mean, you might have got it from one of your sexual partners. So you make sure you inform it to your sexual partner, and they should be treated too. So coming to the complications, pelvic inflammatory diseases for women, that is, it might lead to infertility. So this is how a Trichomoniasis parasite or protozoan looks. It's a motile, jerky movement protozoan. It will be moving. This is a sample which we got it from wet prep. Actually, here in the diagnosis, like here I was saying microscope analysis. The microscope analysis is also is nothing but you take a swab from the vagina, from the cervix, and then assess it under the microscope. That is called wet prep. When you do the wet prep, what happens is you can see Trichomoniasis and other organisms, whatever is present in that sample which is being collected. So basing on this sample, you can diagnose it's a Trichomoniasis or Candidiasis or any other infection, sexually transmitted infection. There's a little toy. And here you come about, so how to prevent yourself. Use condoms. Because this is a female condom. You want to have intercourse with your intimate person, have it with using condoms. There's a female condom, and there are some myths, but one myth is, condoms is used to protect, is a barrier for sexually transmitted infections. Yes, it is a barrier for sexually transmitted infection. So again, you need to use condoms. So there are different colors of vaginal discharges. So each has its own peculiarity. So we need to know about it. And if you have any questions, please don't feel afraid to ask any of your healthcare providers. So asking is better to know about it before, rather than sitting and feeling afraid about it. Thank you.